Good afternoon, everybody. Hey, so I today am going to do a class on, well, I have a more fun class for tomorrow. It's something I found out, but today, since tomorrow's Friday, so we'll do the serious stuff today. But I just want us to understand a little more, the more information we have about COVID and how it spreads and how it mutates. So each um, everything has sort of a metamorphic or evolutionary chance to change, like mutate when it comes to diseases, because just like everything, the disease really wants to live and it wants to thrive, and so it will find any way it can, and then it mutates into other things and to different variations. So I'm going to go over what the CDC classifies as different variants. I call it, so they have different three different ones. The first one is a variant of interest. The second is a variant of concern. And lastly, there's a variant of high consequence. So we just want to go over, to see basically what these could be. So let's just get started, jump right in. So a variant of interest, so I'm going to kind of take down some of the scientific language, but a variant of interest is basically something that's not too bad, but it is, if it makes a significance in terms of cases when it comes to COVID-19, then, it kind of gets the scientists to be like, oh, or people from the Centers of Disease Control, be like, oh, this is something we should look at. We haven't noticed this before. So it's not like for these, like the World Health Organization isn't that worried about it, but it is something to watch, and to see if there's any changes as we go. So, and some of the things that we do, so if you find a variant like this where it's kind of that there is a potential impact, and possible, basically disease transmissibility. So something that could spread to other people, and so they might do a few different changes in order to make sure that they might do some surveillance testing, like we're doing here, but it's just to be safe. So right now there's certain things that are variants of interest, but that they're not. It's not a high. Well, it's not something that they're as concerned about. It's just something to watch. Now, a variant of concern, so that's like this second level up, is the difference between that and one of interest, is which there's evidence of an increase in transmissibility, so more severe disease. So, for example, increased hospitalizations or death. So that would be, so that it's a step up for sure from the last one. So it's not just watching anymore. Now they're seeing actual results from this variant. And so it doesn't say, but the World Health Organization calls this an alpha. But this could be, considered maybe because there are several variants right now. There's the Delta and then the Lambda, which is following it. But there were some others, and those would be variants of concern. So variants of concern might require one or more appropriate public health actions, such as notification to the World Health Organization, reporting to the Centers of Disease Control, or CDC, more testing, and research to determine the effectiveness of vaccines and treatments against the variant. So, it's like it's a step up for sure to be like, okay, well, let's see. And so I would say that probably the Delta variant is a variant of concern, and that there have been an increase in hospitalizations and deaths. But the vaccine seems to be working just fine against it. I think it's like 99% of people that have gotten it or been infected with this variant, are people that have not been vaccinated. So that is a variant of concern. Now, a variant of high consequence. So this is when people are like, okay, we really need to look at this. So a variant of high consequence has clear evidence that prevention measures or medical countermeasures have significantly reduced the effectiveness relative to the previously circulating variants. So that means this is a variant of high consequence because you had a variant of concern, and so you're looking at it and you're like, okay, there's been increased deaths, there's hospitalizations. Now the vaccine's not even working. So that's a high consequence. Like, now we kind of have to go back to the drawing board and figure out what we're going to do, because this is a whole new strain that we're not sure what to do with. Now, we haven't ran into this yet, but I would say, but COVID-19, when it first started, that became a variant of high consequence, because the COVID-19 existed before it infected everybody. It just didn't infect as an airborne or, a way of catching it and things like that, off of sneezing or coughing, and then we have to require masks and everything shut down. Well, that's a variant of high concern. So, of high consequence, sorry. But we aren't there yet for any of the other ones, which is good because the vaccine is really helping. So again, thank you all for getting vaccinated, those of you that did, because it does really help. It helps you. It also helps keep other people safe. So a variant of high consequence would require notification to the World Health Organization, reporting to the CDC, of course, an announcement of strategies to prevent or contain transmission, and recommendations to update treatments and vaccines. So that would mean, basically, if we had another variant of high consequence, that everything would shut down again. They would have to come up with a new, knock on wood, they would have to come up with a new one, a new vaccine, and really start studying it even more. So, that being said, make sure that we're doing our safety stuff. Make sure that you sanitize quite a bit, because we don't want any variants of high consequence. We don't even want variants of concern. Now, variants of interest, that's fine, because at least it's there, but it's not spreading. So scientists can study it and hopefully not release it out into the world or anything like that. So, as things as they are now, what we have to do is wear N95 masks, and I'm going to show you how to put one on today. So this is my practical purpose part of this. So you can, it's easier for me to not put the mask on with my glasses on. But so you're going to have this part, which means that's where your nose is going to go, so that you can pinch in and make sure that, it's as comfortable and kind of keeping everything up. But both straps need to be around, so you can't just have one. You got to have both straps. So there's one. And there's two. And then fix your hair if you have some, because you want to look good in their mask. But really what you want is for it to be as comfortable as possible. And there you go. Now with these masks, it's a little more difficult to breathe, only because that's why they're N95 masks. They really keep everything out. And so, they kind of fog up my glasses, so I have to learn a new way of breathing with the mask on. Let me show you. See? If I breathe through my nose, my glasses fog up. If I just breathe through my mouth and control my breath, then my glasses don't fog up. But it's important to learn how to do to make sure that if you do have glasses, or just making sure that it's safely around you and comfortable, because you're going to be wearing it all day. That's how you put it on. All right. Well, I miss you all, and I hope to see you very soon. If you have any questions, comments, concerns, anything like that, suggestions, please let me know. All right. I'll talk to y'all later. Bye.